This episode of EMS One-Stop is brought to you by Lexipol, the experts in policy, training, wellness support and grants assistance for first responders and government leaders. To learn more, visit lexipol.com. That's lexipol.com.
We have over, like you said, 120 counties, and of those 120 counties, I think they're considered, the federal government considers, I think, almost 106, 107, 8, 9, somewhere through there, that are considered rural. And when you take the average run of these small rural services, you're looking at probably somewhere between the 4,000 and 5,000 runs per year, and that's not going to generate a lot of money. So you got to come up with that money somewhere else. So it's either the city councils or the fiscal courts are actually kind of subsidize some of those, and some of them are actually ran by private companies, and so they've got to be subsidized as well. So I mean, it is hard to put on an EMS service in this state with the very low tax base that we have, or some counties don't even have a tax base for their EMS service.
Hello and welcome to another edition of EMS One-Stop. I'm your host, Rob Lawrence. Now, a few months ago, I went out to Bardstown, Kentucky to take part in a leadership training seminar for the Kentucky Office of Rural Health. And it's their initiative every year to take a cohort of up to 15 EMS junior and sometimes senior leaders and mentor them through a program of instruction on leadership and actually just how to run EMS. And so part of that day, I also sat down with Amelia Holliday, the host of the Kentucky Office of Rural Health's Bridge podcast, in order to just chat through the day, chat through my vision of leadership. The other guest on that podcast was also Scott Helle, who's from the Kentucky Office of Rural Health and is their EMS lead. And Scott masterminds, leads, runs, curates the program for upcoming leaders. And so Scott also talks about the leadership challenge in rural healthcare areas, talks about the delivery of rural healthcare, and we have a great discussion on all of those issues. And so let's jump across to the Bridge podcast and to Scott and to Amelia.
Yeah, so what we've done is the State Office of Rural Health created a leadership program to provide for the EMS professions here in Kentucky. Some of the things that we saw early on when we started getting involved with the EMS was that they lacked some EMS training when it came to administration. They do really great at patient care provider training, but we were missing some areas when it came to the administration, to leadership, how to develop. So we wanted to create that. So we took some time and just sat down and came up with a program and to put it out, and that's kind of what we're doing today. We're actually in our 5th cohort. So when we first started, unfortunately, it was COVID, and we didn't get out in person at that time. But as time evolved and changed, and we got back into meeting in person, we started coming up with different locations. I started looking for unique places to allow our EMS providers to get out of their EMS world, so that way they had an opportunity to learn at a better pace, a better environment for them. So that was one reason why we ended up here at my old Kentucky home. We've got other places like the Corvette Museum. We're doing one of the state parks at Cumberland Falls. So we come up with some unique places to do this. And essentially what we do is we just bring in some national speakers. We have state speakers as well, that actually just a variety of different topics that we feel that EMS providers need to move themselves forward in a leadership role. And that's how I got connected with Rob. Was I also do some leadership development myself, and I go out and look for different speakers, look for different programs to see what I can pull from those programs and bring back to Kentucky to help them improve their skills and and the information that they have. And that's how I came up across Rob Lawrence over here. I was in a program, the Lighthouse Leadership Program through NAMT, and I got to meet him and listen to him, and I felt like that he would be a great fit for Kentucky. A very unique perspective on things, coming from across the big pond, and being able to kind of relate some of the things that he's did over there and kind of compare them to Kentucky.
Yeah, definitely. So I know you kind of talked a little bit about kind of what the point of the Leadership Academy is and why you bring these people in. Can you talk about the process of how these people in the cohort actually come to be part of the academy?
Yeah, so this is actually it's a 6-month program, but it takes me all year long. So once the program's over, I start actually creating the schedule for the next cohort, and coming up with the topics. I attend other conferences to find the topics that are hot and on the top of the forefront of EMS right now, and I pull them in and I look for those speakers. Once I get that schedule lined out, usually around October, we'll start taking applications. The providers, we usually get around 50 to 60 applicants from across the state, people that's wanting to get into the program, but we keep it at a very low number so that way the participants are able to interact with the speakers and feel more comfortable and ask questions. So we do limit the amount. So it's very competitive on getting into this. And we take only 15 people from across the state. We do kind of take and divide the state into small regions, and we pick 2 people from each region. Then once we get those people from those regions, we take and throw everyone's name back in the hat, and we pick a couple people at large from the state. So it is an application process. It's very competitive, but it's rewarding when they do get into the program and they feel like they've accomplished something. So it's very competitive.
Oh yeah, absolutely. And actually, if you are interested in becoming part of the Leadership Academy, and you want to know when the application is going to be open, you can look on our website, you can look on our social medias. We always post in October when it is open. But I think that one of the best things that you've done with the Academy is to ensure that the cohorts are diversified, that we make sure that we get people from all across the state and not just from certain regions.
Yeah, we do get more applicants from our areas that are heavily populated, but like we said, that's the reason why we pick 2 from each region, so that way we do have that diversity. So we do get those people from that far west. I know we got a person that's in the Paducah area this year, and we go clear over to the eastern Kentucky side and the mountains. So we've got everybody in a wide variety. We've had people from fire-based EMS, county-based EMS services, hospital. So we do have a variety of different people. And the program's meant and geared towards younger, new people, that's directors, assistant directors, but we also want to build on that and people that want to get into leadership. So we take EMTs and paramedics as well, that way, because a lot of our smaller services, they have 1, 2, 3 positions, and then it takes a while to get promoted. So we want to be able to start giving them some skills and opportunity to build off of that, and to then hopefully they have those skills that they need to be successful at getting a position.
Right, yeah. And I think, not just are your participants diversified in that way, but I mean, Rob is a clear example of the diversity that we're trying to get with our speakers. So, Rob, I guess this is your chance to jump in finally.
Well, it just occurred to me that I've gone from UK to UK, so so my work here is over now.
Yep,
That's fantastic. And so my Twitter handle is UK Rob L.
That's perfect.
And it just occurred to me, and I've been out on the walk, and they're like, "Oh, are you from Kentucky?" And I have to stop and think, oh, yes.
Yes.
It's y'all, isn't it?
We just needed to add blue into that with there, so we got that go big blue.
Oh, there we go. Yeah, no, it's been a real honor to be here today, to really interact with the folk that are coming in through. And one of the things I said to the students today is that I looked at EMS 2050 as a document, and of course that's meant to be the guiding handrail for us to progress as an EMS profession. Mm-hmm. And one of the things I did for a conference that I also spoke at was to then go back and work out, okay, EMS 2050, that's how many years away? How many of the people that were in the original room that I spoke to, and they were people of a certain age, let's just be polite and call them that. And it turns out that one of them would have been there for 2050. In other words, what we need to do now as a profession, as an industry, is to train, educate, and bring on the next generation, and possibly the generation after that, to continue to be prepared to lead. Yeah. And I think that what Scott's been doing here, and obviously looking forward to the speakers that are coming in as well, and the stuff, and obviously the speakers that you've had, and the mentees or the mentors as well are absolutely critical to actually develop the next generation. And of course, the other thing that I'm very passionate about is that EMS is really guilty of what's known as the Peter Principle. So we're promoting people above their level of competency. That sounds bad. What it means is we haven't prepared them to do the next job, to take the next step.
Right.
And so what's happening here is absolutely vital and essential. And I'm really pleased to see that Scott and of course the whole team are doing this, because it takes a village to put this on, particularly at the scale that you're doing it here around the state, so everybody gets a chance to travel. I love your idea of, they're not in uniform, we are all peers here, and therefore we're going to develop together. And I think, it's absolutely right and proper, and the way that you're doing it, Scott.
Yeah, that was one thing, adding the fact that they need to learn how to be professional, and professional dress is part of that. But at that same sense, we all wear our title on our shirt, and to keep everybody at that same level playing field, I wanted to eliminate that barrier and make everyone feel comfortable and being able to open up and ask questions.
Yeah, and of course today's task has been the ice-breaking day, to take a room full of very silent, timid people and turn them into, louder beings.
Slightly less timid.
Yes, so we had a number of exercises to do that. So I thought that was good fun.
Today was a great opportunity for that. I mean, like you said, when you first came in and started speaking, you could hear a pin drop in this room. At the end of the day, I mean, when they were carrying up, joking, laughing, and actually we gave them a little assignment to create a fictitious item to try to sell somebody, and they came up with some really great ideas. I would love to see them come out maybe in 2075 when we do the next report. Some of these might be some of the items that they kind of come up with. So they are really starting to learn and already grasp the idea of everything that the program is meant to be.
EMS Shark Tank Kentucky.
Yeah, that's exactly what I was thinking of the whole time. I was waiting for somebody to say, "Okay, sharks, what do you think?" But I love those kinds of exercises, and really those are the things that they're not going to get in their EMS service. I feel like a lot of times, especially, I only have experience with EMS in Kentucky, but I would imagine it's similar across the nation, is that you're kind of thrown in a lot of times to your service. You do obviously get training, and you have schooling for paramedics, but I do feel like it's a lot of learning as you go.
Yeah, that was one thing when we started diving down, and we did a listening tour quite a few years ago. That was a common theme that we noticed from some of the people that we were talking to. They got into the position because of three things typically. They were the paramedic or EMT that's been there the longest, or they were the paramedic or EMT that provided the best patient care, or you just sometimes throw in politics, so you get a few extra votes or that kind of favor. And does that necessarily mean that they're the best leader, best director? Not necessarily, because they might be missing some skills that they normally don't get in EMT or paramedic programs, because we truly focus on patient care, trauma, medical type of information, and we just don't stop and think about, okay, we need to train them on administrative stuff.
I think that's the point, that EMS is a business, like it or not. And of course I agree with everything you just said, Scott, that people come in through the sort of the ambulance, which is good and proper, and you need to be able to do that piece, but then you've got to get into reimbursement, into human resource management, into insurance, not only healthcare insurance, but actually you've got a lot of fleet, a lot of logistics, a lot of kit. You've got to be get into the whole purchasing aspect, and there's a whole business element of EMS that people probably don't think about when they come in. But if you want to progress through the system, then you need to understand all of that. And so, which is where I sort of get my Peter Principle idea from. We've given him a white shirt. Fantastic. He was a great paramedic. I know, but now the mission has changed, because now you have to go from leading the folk on the truck to leading the whole fleet of trucks. Right. And there's a big challenge there. And we don't do that very well, but we're getting better at it, and through programs like this. Yeah,
I think the biggest thing is acknowledging that having a certain skill set in your field does not a great leader make necessarily. And so I think that's kind of what things like the Kentucky Leadership Academy is addressing, and and bringing a spotlight to more than anything. Because I know that we have had small cohorts, and that may seem like not a lot if you don't know a lot about the academy, but really this is just bringing a lot of attention to a problem that exists. So
yeah, there's a lot of it brings light to, and some of the other things is also it brings light to cost. It costs money to develop a person, and luckily enough, this is something that we're able to provide to people for Kentucky. Is we don't charge them nothing to attend this program. There's some of the national programs. It takes $4,000, $5,000, $6,000 to attend some of these programs, and knowing that you're potentially some of these small rural services. I know here in Kentucky we don't have a lot of volunteers. It's a very small amount. So keeping them, we might know the life expectancy right now of EMT paramedics is typically 6-7 years. So that's a lot of money that you're investing in somebody that for a short period of time. And so we wanted to try to get the most that we can for these people.
And life expectancy, you mean like job life expectancy?
Yeah.
I just want to make that clear. But yeah, I think you make a good point, is that, you know, Kentucky has 120 counties, and I think there's a service for almost every county except for maybe one. Is that
There's
right?
a couple counties that share services. We do have one county that doesn't have a service, but on average, we have approximately, I think it's 180. I don't quote me on the exact number. It's around 180, 170 services for the 120 counties that we have. Right.
And the majority of the service area that, you know, those 180 or so service is rural, and so it's not densely populated. There's not necessarily a lot of runs, but you still have to keep your doors open just the same as a metropolitan service does.
Yeah, we have over, like you said, 120 counties, and of those 120 counties, I think they're considered, the federal government considers, I think, almost 106, 107, 8, 9, somewhere through there.
It's the good majority, yeah.
That are considered rural. And when you take the average run of these small rural services, you're looking at probably somewhere between the 4,000 and 5,000 runs per year, and that's not going to generate a lot of money. So you got to come up with that money somewhere else. So it's either the city councils or the physical courts are actually kind of subsidize some of those, and some of them are actually ran by private companies, and so they've got to be subsidized as well. So I mean, it is hard to put on an EMS service in this state with the very low tax base that we have, or some counties don't even have a tax base for their EMS service.
You just highlighted, you know, a challenge that's happening across the US, and a number of things that you said there. I mean, thing one is that local governing bodies, boards of supervisors, whatever your name for your local council is, have probably gone years thinking this is a exceptionally low cost item, nay free. We think it's quote unquote an essential service, and the fact is that you're right. When you have low call volume, then the reimbursement is low, where you have the payer mix where perhaps a lot of folk are on Medicare, Medicaid, then the payer mix is probably even lower, because no matter what it costs you to do the job, the reimbursement is significantly less.
Right.
And so we're running constantly, potentially at a loss. Therefore, we have to go to our state house, to our federal hill, in order to keep EMS alive via reimbursement and funding. Interestingly, there are, in the United States, there are actually 15,000, I looked this up on NEMSIS, there are 15,000 registered EMS agencies across the US. Now, people think of America as a large country, and certainly, you know, in the UK, I'm thinking America, they must have huge ambulance services and huge EMS systems. No, because every county, as you said here, has an ambulance service. And so that leads on to, once you've seen one EMS system, join in everybody, you've seen one EMS system. And of course, within that, you therefore have to you have some sort of hierarchy, you have leadership, you have all those sort of funding and regulatory issues, times 120 for Kentucky, times, you know, however many for California. I mean, there's so many EMS leadership roles for which we probably don't have enough people to be in those leadership roles. And there's so many ambulance organizations that make funding unaffordable. And because you're only doing 5,000 calls a year in a rural system, but I bet you those 5,000 calls, the transport, the job cycle time from going to the patient, then going to X miles to the hospital, which means that the one ambulance that's on duty is now gone, and therefore the next patient doesn't get one. Those are really super rural issue challenges. And I came from a rural ambulance service in the United Kingdom, so we had 35, 40 miles to hospital. when the one ambulance was gone, then what did you do?
Yeah.
If you're the first patient, great, you win. If you're the second patient, you got a problem. Well, we answered that with this thing called paramedics in the community. And then somebody went, oh, no, let's call them community paramedics. And that was, where we got our start from in the UK. So we have to, be innovative. We also have to have a plan to survive within the EMS system. And to survive, you have to have leaders. And this is exactly what you're doing.
Absolutely, yeah. And bringing up how EMS and EMTs and paramedics are kind of viewed in other countries. I know that's something that Scott and I have kind of had conversations about, how there's just a different reverence, I guess, for that profession in places other than the United States. And then also, the United States is huge. I mean, obviously we have 50 states, but we don't do EMS the same in every state. There's no, overarching way to do it so that it's, equal across the board.
Yeah, it's just like I was talking. Kentucky, we don't have a lot of volunteers, but you go to a lot of the western states, and they truly operate off of volunteers. I mean, they got 10 people that might volunteer to run their ambulance service, and if they don't have the people, if they're at another job during the daytime, sometimes they have to rely on another community 20-30 minutes away to even respond. And I know the terrain in some of the Mountain West states is also plays into it. We get to see a little bit of that here in Kentucky with the Appalachian Mountains, because sometimes you got to go around them 2-3 times to be able to go somewhere. So yeah, it does pose a problem for that.
My first 10 years in the US was in Central Virginia, where pretty much every second squad was volunteer. And of course, how did they survive? Well, they survived from the goodwill of the great citizens of that community. And, Kentucky, you probably can relate to this, shaking the boot outside the food line on a Saturday morning, right? So they were there fundraising and people gave willingly. Well, of course, those volunteers and volunteerism is a diminishing return now. Local organisations then have to go, you mean we have to pay for this? Yes, because I know I can get people to come and cover the night shift because they're not at work. I now need to pay professionals to come in during the day, and that's going to cost you, alderman, supervisor, whatever you're called, and that becomes a bit of a challenge because we get police and ambulance, we get police for free, and we get fire for free. Well, yes, sort of, kind of, but you have to pay your taxes, and now you're actually going to have to invest in the ambulance service because the reimbursement level they get from insurance and from the central government probably isn't going to cut it in a rural area because you've got to cover this amazing thing called the cost of readiness, not just the cost of transport. And it costs, if you've got one ambulance for 24 hours a day with 2 crew, what does that mean? Well, actually, you don't need 2 people to run 24 hours, 24/7, 365. You need 8 or 9 people to do that, to make that 24/7 crew up. So there's a huge cost there that may not come in through reimbursement. And so people have to be prepared to dig deep and fund it, otherwise it's going to disappear. Then you just talked about that, and I saw this in recent EMS news stories where community A have their ambulance, community B decided they can't afford the ambulance, so they're going down to 1 truck instead of 3, and then they want the other community to come in and do mutual aid, and they're like, oh no, hang on, stop, there's something wrong here. And then you get into this kind of into border wars, dare I say.
Border wars, and who's to pay for us coming into your community to help you make your runs?
Right.
So yeah, it does cause some problems on a political standpoint, and even on a local, on the volunteers, because now they've got to go additional mileage to be able to get to a patient.
Yeah, it's. I don't envy folk delivering and dealing with rural EMS in the US today because of all these challenges. And of course, the other confounding factor is the local hospital may not be there anymore. Yeah. What does that mean? It means that your run to a hospital has now tripled, doubled, and therefore that increases the challenges upon EMS, which is primarily there to save life in the community. And now you've got to go to an extra 30 miles on the round trip already to take a patient somewhere. It's hugely challenging.
Yeah, I feel like that's the common theme with rural, especially in America, is that it's just increasingly challenging, and we have everything kind of working against us already. We don't need everything else to add on to it. So spinning from this incredibly positive conversation,
we can do it.
I do think that having things like the Leadership Academy is incredibly positive and takes those issues that we were just talking about and does spin them kind of on their head, like, hey, yeah, we know we have these issues, but we are from this area. The majority of us are rural. We are very resilient. Let's figure out how to, pull up our boots and fix it.
And that's some of the things that they learn from this project, from this program, is that they're not unique to Kentucky. That we have a lot of these different issues that a lot of these other states have, and these speakers come in and talk about it. But it also, at the same time, we give them assignments to make them think and to ask questions and compare notes to other people, and even just from east side to west side of the state, we handle things a little differently. It gives them an opportunity to work with people of their same level and to ask those questions and to be able to help them. So yeah, that's a positive thing to come out of. And we do some group projects as well through this program, and it gives them an opportunity to think and maybe create a solution to some of the problems that they are seeing, and hopefully maybe it could change a solution that they come up with for Kentucky or for the nation. So it's a great opportunity for them to be able to build off of.
Yeah, kind of thinking outside the truck or thinking outside the ambulance. Some of the stuff that Scott does in some of the assignments he's talking about, one of them's coming up in one of the next meetings, I think, where it's just a writing assignment for a memo.
Yeah, we try to come up with assignments just to help them make them think.
Kind of real life situations.
Real life
too,
situation,
yeah.
Because some of them don't necessarily have HR departments within their services, and they've never really thought about how do I communicate? How do I write a memo? And sometimes some people just do a plain, simple email, but it's how they put the message across that email, and it didn't come quite the way it needed to be, or the legal way of it. So we want to try to teach them some skills to help them have and build off of, so that way they are staying within the legal aspects of things and creating a good message. And
effectively communicating. Yeah. Because I think anybody can send an email, but if it comes from your leadership, it needs to have not just a certain look about it, but a certain feel and a certain tone. And I think that's some of the stuff that you're teaching them.
Yeah, it's a variety of different things. I mean, we bring in HR questions. We bring an EMS lawyer in. We bring in compliance. We bring in different people. I bring in people that don't even have an EMS background. I got a minister that comes in and talks just about how to communicate with people. That's some of the things that we do to try to help. They might be talking about the same topic and the same information, but it's presented different ways, and it might generate with one person differently than a different person. So that's some of the things that we try to do to help build them on their leadership skills.
Definitely, and I'm probably biased as a communication specialist, but I think that is one of the biggest things of being a leader, and a good and effective leader, is to be able to communicate effectively with the people that you're leading. You can't lead without effective communication. And I really was intrigued with your talk today, Rob, especially talking about your background and how you almost bring that military background into how you approach EMS now. If you want to talk a little bit about that.
Yeah, well, first of all, my background is an Army officer, and some of the lessons and the tenets that I have picked up over the years I've brought with me. Now, it doesn't mean I walk into the EMS system and start barking, shouting and screaming and being the Sergeant Major. I wasn't that person. But actually some of the philosophy that goes around the military, the ability to, it's actually leadership and military operations actually is a thinking game. Mm-hmm. You have to be cerebrally aware in order to outthink and outsmart whatever it is that you're opposing. Okay, and the same way goes into leadership as well. You actually need time to think, and so I'm very much sort of a cerebral leader. I think that the fact that I had 6 principles, right, and so I've lived my life by these, and these were sort of instilled in me as a young officer cadet in the military academy, and those are quite simply pride, integrity, learning, humour, service, and courage. Something I teach and tell and ask all leaders to follow those principles, or indeed create your own principles, right? So be very proud of what you do. Integrity is absolute. There's never a day where we do not learn something, whether it's from academic reading or indeed it's from sitting next to Scott and you talking about this podcast. There's going to be a takeaway for us, or folk listening to this podcast. There's a takeaway. There's always a learning opportunity.
Right.
Humor. We laugh at ourselves and with each other. Okay, we don't laugh at other people because that really is not a good way of doing business. Service, we are here in a service industry. We are here to look after that one person. We are there to be a part of that one person's moment of absolute need, the worst moment of their life perhaps. And of course, our commitment to serve them is a good thing. It's a great profession to be in. And then courage. One of the things that I've realized is there are two types of courage. There's moral courage and there's physical courage. The physical courage is the ability to pull somebody out, having the strength to, manhandle somebody out of the burning vehicle or whatever it is you're doing. And of course that requires a skill in itself. But then of course there's moral courage, which is the ability to speak up and to be heard, and to say no when everyone else is saying go. It's sort of crew resource management-ish, I know, but it takes actually some degree of courage to do that. And so again, those sort of tenets and qualities are something that I bring with me and I encourage in others, because I think that's, as a leader, you need to have a handrail with which to live your life. The other thing I talked about this morning as well is that I realized in my military service is that everybody watches you, the leader, in everything that you do, and listens to you, the leader, in everything that you say, and they will interpret what it is. No matter what you've said, they'll interpret what you meant. Or for those listening to this podcast, you have a boss. You know exactly when your boss is in a good mood. You know exactly that when your boss is in a bad mood, because you can read their body language. And therefore, why is that? It's because the leader, maybe purveyed some sort of energy that was not particularly good. And so as a leader, we have to think that we are on deck the whole time. There's no downtime. We are in a performative sort of career, if you like, because everybody's watching us and how we do it. And therefore, think about that through you being the leader, because people are going to take energy from your energy. If your energy is bad, it's going to be bad energy, and then it's going to pervade through the organization. So having some key principles and remembering that everything you do is being observed upon.
You're always leading once you start leading. It never kind of stops. Yeah.
No, you don't stop leading.
Yeah.
And people are watching. People are listening. People are talking about you, whether you like it or not. People are talking about you behind your back in the crew room. Once they get out onto the parking lot, it's amazing what he said, or I can't believe he said that. It's one that goes one of two ways. Okay, and so try and make sure that you think about how you lead and what you say and how you act, because everything starts with the leader, everything starts with the boss, and it all pervades and flows out from there. And it's a big responsibility. Oh yeah,
and I think this is just some cliche saying that I think they have in movies, but a good leader does not want to be a leader. I think in part because of that.
Yeah.
Because that you're always going to be responsible for how you act and what you do and what you say from then on.
Right. So, and as we talked about this morning, a good leader is actually the servant leader. So I'm here to work out how I can support you. We work out how we can trust each other, how we can actually function as a team, and then I'll give you the resources and the trust and the freedom of action to go out and achieve. And by doing that, people are more engaged, and the task is complete, without me having to resort to being the shouty person that I'm certainly not, because I've found over the years that building a team is the first activity, developing the trust is a key activity, and then we have a shared mission and vision, and then a way of approaching it. And it's certainly worked in my case anyway.
Yeah.
Lexipol empowers first responders and public servants to best meet the needs of their residents safely and responsibly. Serving more than 2 million public safety and government professionals in over 8,000 agencies and municipalities, Lexipol offers a range of solutions that includes policies, training, behavioral health resources, news and analysis, and grant assistance services for law enforcement, fire and rescue, EMS, local government, and other agencies dedicated to public safety. To learn more, visit lexipol.com. That's LEXIPOL.com.
And we're back. Before we go back to the conversation, please make sure that you like and subscribe wherever you get your podcast or vodcast from. Remember, we're on Apple Podcasts and we're also on YouTube, so you can either see us or hear us. Remember, I say this every time. Make sure that you look at us on YouTube if you're listening, because we also put charts, graphs, or in this case, you can actually watch us in the room recording the podcast itself. So let's get back to the chat.
Yeah. Not to give away all of your trade secrets, but I wanted to kind of go back to, you had mentioned earlier about EMS and EMTs. The job itself it can be, kind of chaotic, and you're with people in some of the worst times of their lives sometimes. There was an activity that you did with the group today that I thought was really interesting, and I kind of was hoping you could walk us through it a little bit, about the flooding.
The icebreaker.
Yes, the icebreaker.
Yeah, it's an exercise that if you're about to have this done to you, don't listen to this. Look away now. But it's a leadership exercise that I've certainly done over the years, where you have three groups, and you have a group to which a leader is appointed. You have a group to which everybody gets the briefing, and then you have a group that has perhaps somebody that might be a little bit disruptive. And just to watch the style and the technique and the way that human beings interact with each other is fascinating. And remember, today these folk had only seen each other on a Zoom screen. They only thought that it was just Head and Shoulders existed. Right now they're seeing the rest of them. Yep. And so the exercise was meant to do a number of things. One, to break the ice, and two, when we came back and rebriefed them, for them to go, I see. And of course the point being is that when you have one leader, did that leader lead, and how did followers follow? Because in any organization you need to have good leadership, but also you need to have good followership. And it was fascinating because the one person had the instruction, and if you looked, and you may have taken photographs of this, they were all leaning into the middle on their chairs, sharing the instruction and being very collegiate.
Yeah.
The other group, of course, everyone got a piece of paper, and there was no leader appointed, but they all had the piece of paper, and you could see just by sitting back looking at these tables that Group A here are all their heads are in a huddle. Group B, they are actually sitting back conference style, like they're having some sort of business meeting. And there was a difference in the dynamic there. And I asked them to think about that. And the third group, well, I asked somebody to be as disruptive as you can, to be disagreeable, because life's like that. Sometimes people are going to come along and not say. And of course, these people didn't know each other, and it went kind of the way I thought it was. Everyone's really polite, and this one person is being so. Anything, if it's black, it's therefore white. If it's red, it's green. If it's 1, it's 4. And nothing was agreed upon. And of course, how do you as a leader and indeed a team member deal with that? And again, when we stopped the exercise and said, what did I ask you to do? And the answer was, you asked me to disagree with everything. And they all went, there we go.
It makes sense now.
It makes sense now. But the point being, again, is it's an exercise in, well, how do we work with that? Because you could be on the truck, on the street, and you have, this today's disruptive student could well be a family member, a son, a daughter, a friend of the patient that disagrees with your diagnosis, or doesn't, their Google search says it wasn't that, it was this. Right. We've all been there, right? And so there's just sort of ways, and again, just sort of coaching methods of well, how do we deal with this? And the group with the disruptor student did really, really well. They were very polite but very firm, and actually I was watching them, and they really stated their point. They stood their ground effectively. But again, it's just an exercise that anybody can do with a scenario, and the scenario was you've got to get 10 people down the river. And of course, nobody asked me any questions, and so people came up with imaginary rope and etc. But again, it's just a little bit of fun. And the room went from, you mentioned this, the room went from, I was, the opening act. So first thing, the pins dropped, and the next thing, there's a buzz going around the room as they're trying to get engaged. And so it broke the ice, but also it's an exercise in group dynamics. Although at the time they didn't realise they were the guinea pigs in an exercise in group dynamics.
Yeah, always be on your toes around Rob.
Yes,
indeed. The point of this. Yeah.
Yes.
I think learning about and strengthening those interpersonal skills is is huge in EMS and something that really isn't thought about. Scott, would you agree?
Yeah, no, and that's the reason why we wanted to bring some people like Rob in here to help them build some of these skills and have that a better understanding. And the academy, that's what it's meant for them, is to build off of and to think outside the box and to try to figure out how to handle different types of employees and working as groups and how to interact and all that kind of different stuff. So yeah, that's what the program is meant and for and designed with in mind, so that way we can help them become that next leader, become that next person that helps the state move forward. We're always looking for more people. We're saying we don't have enough people. I wish somebody else would step up. Well, this group right here, they're stepping up now. We just need to provide them with the resources and the information so hopefully that they can be successful and be that next person to step up and take over.
And I think the network shouldn't be underestimated either. The network that they're building now, I mean, from the cohorts of leadership, the Lighthouse program you have a network of folk that you can call upon. This group here, because it's a Kentucky-only network, these sort of folk that are a lot of them have just become directors or supervisors, etc.
Yeah.
This is the Governor's Advisory Board of the future sitting here for the state. The state EMS Advisory Board is sitting here now, and of course what we're doing is we're creating that relationship and that ability to pick up the phone and work with each other now. And that's a fantastic thing, because they will. I remember in Richmond, I was there for 10 years, and the guy that was the deputy chief is now a fire chief somewhere else, and you grow up with these folk. And then, of course, they become part of your, dare I say this word, Rolodex, right? They're there.
Yeah.
Look it up, folks. Yes. So.
But that's the reason why I always have the mentors attend all these sessions with them, is so that way they can interact with the mentors and ask questions, and the mentors can verify and validate a lot of what's being talked about and said. But the mentors, they also learn just as much from the mentees, so that's a positive, because now they're learning a different approach and new ideas and a different thought process, and they also then are able to change potentially some ways of how they look at handling situations within their own EMS service.
I want to comment on that. I think you're absolutely right. I do the Lighthouse Leadership Mentor Program, the AAA Next. So all the national associations wonderfully now have mentoring programs, and there isn't a mentee that I have that I'm either not enlivened by or learn something from, or I'm enthused by their zest for the business. And so it's really good for my old soul as well to do this, because you can get that insurance that the future is actually bright, and these people want to drain your knowledge, and I'm happy to have my knowledge drained these days in order to make sure that we carry on.
Right. Definitely. Yeah. And I think it's almost like, and I never really thought about the mentors taking something away from this experience, but it's almost like that next step up in Leadership Academy, kind of like the graduate level of Leadership Academy.
And I've actually gotten now, one of my mentors is a participant from the first cohort. So, I mean, now they're paying back and giving back to the next leader within their group. So yeah, it's a pay it forward type of program.
Yeah, no, I totally agree, and that what this is doing is encouraging, because they will go away to their organizations and they will they will pay it forward and down now. Even if they're in this program, they'll go, actually, you know what, I've got my 4 supervisors that work under me, let's do something similar, let's steal Rob's exercise and see how, but please do take it away. But it's really positive. It's a positive thing to do. And people that say, what do I want to go and talk to that old guy once a month? Well, actually, it's a two-way street. And also, it's phone a friend sometimes as well. That I've had some fairly juicy, wrong word, I suspect, HR discussions that I can actually be that voice on the end of the phone to say, well, actually, in my experience, I've done this, this, and this, and it seemed to have worked. And then to allow me to give you the benefit of that particular piece of wisdom, as opposed to we've always done it this way, or back in the day, or when let's try and work through the issue with you. And as a mentor, and I'm sure you're the same, Scott, that I'm delighted to be able to help that person solve the problem they're having at the moment. And again, it's very gratifying for me and hopefully satisfying for them.
Oh, I can imagine that. That's absolutely right, because, I mean, you're kind of helping bring up the next generation of EMS who may have gotten into it for the same reasons that, you know, you have gone into it, or you did get into it when you started.
Yeah. No, I think we have to bring on the next generation. We have no choice. You know, if you're one of these sort of folk that are 9 to 5, and I know people are 9 to 5, that's great, but actually we you know, it's inherent upon us in the particular the way that EMS is set up in the US. Therefore, we're never far away from the top of the pyramid to the bottom of the pyramid. We're invested in it, and so we need to make sure that we can continue bringing people on. And it's, of course, the challenge is that in these small EMS systems, there isn't necessarily room for upward promotion. And it's now that's a bad thing, but the good thing is if we all mentor and teach and train and educate our folk, then they can move across to the next service where there is a vacancy and do the job. Sometimes I tell folk, you know, I've had conversations with people who come and say, I'm going to move on from the service, and I'm like, you know, sometimes you've got to go away to come back. You know, we've given you the skills in order to get that. We gave you the skills in order to get that job. Go over there and flourish.
And now they have the confidence to make that lateral shift if they need to.
Yeah. Two of my supervisors in Richmond in the early days ended up becoming consultants at Fitch.
Oh, wow.
And changing the life of systems. Yeah.
And that's some things that we've had, some success stories that we've had with the leadership program, is people come through the program and got confident and within themselves, and then went and applied for other jobs with other services or organizations within EMS and got those jobs. So it's great to see those people move forward and be successful. So that is a positive thing from the program.
Absolutely. But all right, I appreciate you all sitting down and talking with me instead of running off at the end of the day. And you all have safe trips home.
Thank you very much. I hope to see you all again soon.
Oh yeah, definitely. Yep.
Fantastic. That's it from the recording of the Bridge podcast. If you want to listen to the whole session and the whole discussion, the link for the Bridge podcast is in the show notes. So please make sure you click on, and actually we have a quick fire round afterwards where we talk about leadership issues in general. So please click in and have a listen to that as well. That's it for another edition of EMS One-Stop. I've been your host, Rob Lawrence. Please make sure that you like and subscribe. EMS One-Stop podcasts now drop every Thursday, wherever you can see us or wherever you can hear us. So that's it. Until next time, bye for now.